Traditionally, extended families have taken care of elderly members during old age, but that's now changing, meaning aging Africans are facing new problems, a reason for concern as noted by the United Nations Population Fund, which estimates that around 50 million people above the age of 60 account for around 5% of sub-Saharan Africa's population. An unexpected illness or injury can create severe strain on individuals and their families when there is no insurance cover to meet the costs of age-related medical costs. Yet, this is the position that most Kenyans who are used to enjoying job-related medical covers whilst in employment find themselves in retirement, a situation of typically no medical cover at the time when it's needed the most, inadequate savings, and increasingly, inability to rely on children and family for support, and there is virtually nothing.
Statistics has shown that most people who retire really die off in retirement at early ages just because they cannot be able to access good medical care in retirement, or they can't afford that good medical care in retirement. We've managed pension schemes, and most people who retire, they of course drop off from their company medical schemes, and they don't have an alternative in terms of where they can be able to save to be able to get medical cover. Most companies, especially insurance companies, will charge quite exorbitant prices for medical care for old age. Some of them will not even provide for medical care for anybody above 60 years of age.
In 2004, the Kenyan Parliament passed a law on the NHIF with a long-term vision for the existing National Hospital Insurance Fund to increase membership and extend benefits so as to be better prepared once social health insurance take off. Similarly, the Retirement Benefits Occupational Retirement Benefits Schemes Regulations 2000 was amended to allow for registered retirement benefit scheme to receive additional voluntary contributions from members in respect of funding of a medical fund to be accessed at retirement. In addition, it provided that retirement benefit scheme rules shall be amended to allow a member an option to transfer a portion of the member's benefits to a medical provider where a member has been unable to build a post-retirement medical fund from additional contributions. It's in this spirit that Octagon Africa, a leading regional financial service providing pension and insurance services to individuals, non-profit, public and private sector organizations, in partnership with AAR Insurance, a leading medical insurance provider in East Africa, developed Afya Plus post-retirement medical cover.
We as Octagon Africa have decided to get into provision of post-retirement medical savings plan so that our members of pension schemes that we manage currently, which is over 60,000 membership, we would like to have them saving for retirement, and alongside that they should be able to save for medical care in retirement. What we are trying to do is to have a scheme that will help the younger people who are in employment today to save for retirement.
As AAR, we have made it deliberate to partner with the Octagon so that we deliver a robust solution to our members who are retiring. The role of AAR is to develop products, underwrite or make sure that the products are consumed according to the rules set out, and administrate or do what we call case management in case members are admitted or they seek outpatient services, and make sure maintain a clean list of members who are insured as received from Octagon.
AAR Insurance, a licensed financial services provider in Kenya and a member of the Association of Kenya Insurance, AKI, empowers its members to take control of their health. This is achieved through provision of products that enable members to control their own medical expenses and tools to influence their own health status. This is the premise on which Afya Plus has been developed jointly with Octagon.
The unique bit in this product is that members are going to be managed through a robust program that AAR has established to take care of chronic and pre-existing conditions.
In terms of the limits involved on Afya Plus post-retirement cover, inpatient limits are from 1 million to 5 million per person per annum, renewable every 12 months. And on outpatient, we have limits from 100,000 to 200,000 based on the member's preference.
Research shows that most employees in Kenya are keen to save for their post-retirement medical benefits. Therefore, several employers are looking into participating in a post-retirement medical scheme. However, being a new development in the Kenyan market with lack of robust regulations, only few employers in Kenya have established their own freestanding post-retirement medical schemes.
We believe that having an in-house medical scheme for organizations, it is quite costly. Managing small schemes is very costly, and therefore we have come up with an umbrella fund which makes sure that there is a management of numbers, that we have many numbers, and therefore we get better actuarial rates in terms of premiums when somebody retires at normal retirement age.
Afya Plus post-retirement medical scheme is an exciting development which recognizes and offers solutions to some of the inherent challenges faced by employers in setting up post-retirement medical schemes.
As Octagon, we are very excited about this new development for Afya Plus post-retirement medical scheme. We believe it provides a solution to most employers who have been looking for solutions in terms of taking care of their retirees at old age. And secondly, as well, we are very excited because we are partnering with a reputable firm, AAR Insurance, who in terms of coverage and also in terms of medical provision, they are well known in the market. They are the second largest providers of medical insurance. And in terms of strategic presence, as Octagon, we have we are in 3 countries at the moment, and in those 3 countries, AAR Insurance as well have presence there. So we believe that we are able to synergize and have this product rolled out even beyond the borders of Kenya, and ensure that there is coverage for people who are above age 60 years of age.
The cover also pays for rescue evacuation in cases of emergency, giving you and your loved ones peace of mind in retirement.
We also have overseas treatment where we are not able to get treatment locally, or where it is we can get better outcomes abroad. We have partners mainly in India and South Africa and other places, where then we facilitate the whole process when our member requires treatment outside the country.
For more information on Afya Plus post-retirement medical scheme, visit www.octagonafrica.com.